Welcome everyone. With our research team, made by Natalia Fonseca, Juan Sebastián Bermont, Juana Montaño, Sara Yara, Emily Reyes, and me who talks to you, Antonia Ferro, today we're going to explain to you our investigation, effects of doll therapy on depression in patients with neurocognitive disorders in a geriatric home in Bogota, a pre-post intervention study. Hope you enjoy.
More than 55 million people worldwide suffer from neurocognitive disorders with Alzheimer's disease as the leading cause. Dementia affects memory, reasoning, and daily life, impacting both patients and caregivers. The Cornell Scale for Depression in Dementia, also known as CSDD, helps diagnose depression in these patients. Doll therapy, a non-pharmacological approach, is based on attachment theory, providing emotional security, reducing anxiety, and improving well-being. This study in Bogota evaluates doll therapy's impact using the CSDD, offering an accessible alternative to traditional treatments in geriatric homes, hospitals, and nursing facilities.
Our research question is, what are the effects of doll therapy on depressive symptoms in patients with neurocognitive disorders in a geriatric home in Bogota? The general objective is identify the effects of doll therapy in elderly patients with depression and neurocognitive disorders, and our specific objectives are apply the theory of doll therapy in elderly patients with depression and neurocognitive disorders, and second one is analyze the results with pre-test and post-test of the application of doll therapy on behavioral symptoms in patients with depression and neurocognitive disorders.
So the theoretical framework is based on John Bowlby's attachment theory. According to this theory, human beings have an innate need to establish emotional bonds that provide security and well-being. For example, in patients with dementia, this need is intensified by memory loss and disorientation, which can lead to anxiety, agitation, and depression. For this reason, doll therapy is based on this principle of attachment, and it has been observed that providing patients with a doll that simulates an emotional relationship can help them experience calm, connect emotionally, and reduce anxiety.
Also, in our theoretical framework, we have our PICO strategy. We use two main engines, Google Scholar and PubMed. In Google Scholar, we found 2,910 articles, while in PubMed, we found 13. We selected 3 from each database after applying the exclusion and inclusion criteria. Our key takeaways were 2. The non-pharmacological therapy that improves mood and well-being in senior citizens, and the potential for a wider implementation in dementia care.
Our study is designed to evaluate the effects of doll therapy on individuals experiencing depressive symptoms or living with neurocognitive disorders. We use a quantitative pre- and post-intervention approach, measuring change in depressive symptoms with the Cornell Scale for Depression in Dementia before and after the therapy. The study will focus on patients with neurocognitive disorders living in a nursing home in Bogota, based on previous research and the capacity of local institutions. Should be enough to ensure the statistical reliability of our results. We use not probability convinced sampling, selecting participants based on availability and whether they meet or inclusion criteria. To be included, individuals must have a confirmed diagnosis of moderate to advanced neurocognitive disorders, be 65 years or older, live in a nursing home in Bogota, and show depressive symptoms as evaluated by the Cornell Scale.
Continue with the methodological framework, we are going to explain the exclusion criteria and the variables. In the exclusion criteria, we found that severe major depression, cognitive impairment, medical and stable conditions, a history of severe aggressive behaviors, recent of use of psychotropic medications that could affect the therapy evaluation, and the independent variable is doll therapy implemented through stricter sessions. The depend is the depressive symptoms, access before and after the therapy, and finally the control variable is the time of measure with the pre and post intervention evaluation. Finally, the measurement instrument that we are going to use is the Cornell Scale for Depression in Dementia, which assesses depression in patients with neurocognitive disorders across 5 areas like mood-related signs, behavioral disturbance, physical signs, cyclical functions, and additional disturbance. And finally, the hypothesis is the implementation of doll therapy in elderly adults with neurocognitive disorders in a nursing home in Bogota that significantly reduce depressive symptoms as measured by the Cornell scale and comparing pre-test and post-test results. In the analysis framework, the type of design that we are going to use is the quantitative, pre-experimental, pre-test, and post-test. In the statistical analysis, first in the discrete analysis, the qualitative variables like frequencies and percentages. In the quantitative variables, mean and standard deviation, if normality is confirmed with the Shapiro-Wilk test. In the inferential analysis, Wilcoxon sign rank test no parametric for comparing pre and post results, and the significance levels be less 0.05. And finally, the expected results that we are going to find with this intervention is that significant reduction in depressive symptoms improve the emotional well-being, and the therapy based off attachment theory encourage effective connections.
Our results can be compared with international studies like those by Pesati and Stan Santagata, which show that talk therapy helps reduce depression and improve emotional well-being in people with dementia. This comparison will deepen our understanding and expand knowledge in Latin America, where research is still limited. It may also encourage more human and affordable care strategies in nursing homes. However, there are some limitations. The convenience simply improves generation, the small sample size lowers statistical power, and the lack of a control group makes it harder to confirm that changes are due only to the therapy. Limit experts time and short follow-up also reduce our ability to access long-term effects.
This research complies with the ethical principles of the Declaration of Helsinki, ensuring respect for participants' autonomy through informed consent signed by the patient or their legal representative in case of incapacity. It also adheres to national regulations, including Resolution 008-430 of 1993, which classifies the study as risk-free. Data confidentiality will maintain with information stored sequentially and anonymously. The study will be reviewed and approved by the Ethics Committee of Universidad de La Sabana prior to implementation. Environmentally, the study poses no negative impact as it involves no pooling materials and hazardous waste. Since it applies an existing intervention to a specific context, it does not generate patents, but all copyright and citation standards will fully respect it.
With this research, we'll get the next products: academic and technical outputs, such as a scientific article, a peer-reviewed publication on doll therapy benefiting health professionals, researchers, and nursing students in geriatrics, a technical manual, a guide on appropriate use of doll therapy for geriatric institutions and caregivers. The second one is knowledge generation and research creation, local evidence, a pre- and post-test data on doll therapy effects in dementia patients in both, and the implementation guidelines, a context-specific therapeutic recommendation for geriatric institutions and healthcare workers. And the last one is social appropriation of knowledge. We'll get informative materials distributed to the public and institutions to raise awareness, and educational workshops delivered to caregivers, families, and nursing staff to enhance understanding on the use of doll therapy.
Some of the risks associated with the research are the emotional discomfort or rejection of the therapy by some participants. The strategy to minimize this risk is the prestation emotional evaluation, voluntary participation, and the possibility to withdraw at any time. Other risk is the limited therapeutic engagement. The strategy to minimize this is the personalized approach, regular monitoring of patient response to adjust the intervention as needed, and finally, the misinterpretation of therapy as infantilization. And the strategy to minimize this is the staff training to ensure an ethical, respectful, and person-centered implementation. Some of the beneficiaries that we can find are the older adults with neurocognitive disorders and depressive symptoms, and the benefits that they can get are the improved emotional well-being, reduced depressive symptoms, better quality of life. Other beneficiaries are the caregivers and health staff. The benefits that they can get: the easier patient management, reduced caregiver overload, less reliance on medication, and finally, the institutions and geriatric homes can get some benefits like a generation of clinical evidence, promotes non-pharmacological and human care, And finally, potential for application in other similar contexts.
This project aims to implement doll therapy as a part of the regular care routines in nursing homes in Bogota through technical manual and training workshops. Healthcare professionals and caregivers would be equipped to apply the therapy in a standardized and sustainable way, ensuring it's continued beyond the research phase. Doll therapy is a low-cost, non-invasive intervention which makes it easy to replicate in other institutions across Bogota and different regions in Colombia. Its simplicity allows for broad scalability with minimal resource. The findings from this study can serve as foundation for future long-term research exploring how doll therapy affects factors such as agitation, quality of life, and caregiver burden. To support these educational materials and awareness campaigns will be provided to caregivers, families, and health staff. This project expects to reduce depressive symptoms in older adults with neurocognitive disorders living in a Bogota nursing home. The main indicator would be the pre and post intervention scores on the Cornell scale for depression and dementia. Caregivers may also benefit through decrease in emotional overload, which will be tracked to qualitative reports and observational data. The study will generate evidence of the effectiveness of doll therapy, supporting the development of science-based publications and a technical manual. In the long term, it aims to promote the adoption of pharmacological strategies within geriatric institutions and possibly include doll therapy in official care protocols. To evaluate the impact, we will conduct pre and post intervention assessments using the CSDD scale. Throughout the therapy, qualitative data will be collected through observational and informal interviews with caregivers to monitor emotional response and behavior change.
This is going to be our schedule of activities, starting with the ethics approvals and site visitation, ending with the exposition of the results. Our longest activity is going to be the intervention itself, lasting 3 months.
So, here is a summary of the budget of our project. The total estimated budget is 617,000 Colombian pesos. The main expense include 3 therapeutic dolls for the interventions with a total cost of 360,000 Colombian pesos. The local transportations for the teammates to the geriatric home, costing 300,000 Colombian pesos. And finally, the printing and binding for the final report, which costs 10,000 Colombian pesos. For the other hand, there is no additional cost thanks to the databases of the university and the practice space to do this project.
As a general conclusion, doll therapy based on attachment theory is presented as an effective non-pharmacological alternative to reduce depressive symptoms in older adults with neurocognitive disorders. This study proposes its implementation in a geriatric home in Bogota, evaluating its impact using the Cornell scale, and the intervention is expected to improve patients' emotional well-being, decrease caregiver burden, and promote more human and sustainable care. Despite certain methodological limitations, this project provides relevant local evidence and opens the way to new therapeutic strategies in geriatric care.